Good afternoon, Mr. Chairman and Representatives. My name is Mike Marshall, and I'm the president of the Texas Mold Assessors and Remediators Association. I'm honored to be here with you today representing nearly 5,000 industry licenses in the state of Texas. We have worked closely over the past 2 years with members of the legislative branch, not only to keep our industry regulated, but to protect the health, safety, and financial well-being of the 29.8 million Texan consumers that we all serve. On behalf of TMARA, I'm here today in support of House Bill 605, the Lead in School Water Bill. You may be wondering why the president of an association that represents the mold industry is speaking on a bill regarding lead in school water sources. Well, many of us on the assessment and laboratory analysis side of the industry are not only experts in mold assessments and testing, but we also perform testing for a number of other indoor environmental contaminants that include asbestos, volatile organic compounds, water contaminants, and lead. Our members perform thousands of indoor assessments and testing for these contaminants that include water source testing for many large commercial buildings, residential homes, and schools. In our research of the many documents published by the Environmental Protection Agency and the Center for Disease Control, we've summarized the following with regard to HB 605. Lead is a toxic metal that is harmful to human health, and there is no safe blood lead level established for children. In the human body, toxic lead can substitute for healthy calcium, which is a mineral that strengthens the bones. Lead is then carried through the body, through the bloodstream, and can do significant damage to the nervous system and the brain. Some lead can be excreted by the body. However, what's not excreted is absorbed into the bones, where it can collect for a lifetime. In children, even low levels of exposure have been linked to learning disabilities, hearing problems, hyperactivity disorders, growth inhibition, and the overall function of their actual blood cells. It's also important to note that the EPA's newly proposed lead and copper rule better protects children and communities from the risks of lead exposure by extending regulations to children at schools and child care facilities, working to get the lead out of our nation's drinking water and empowering communities through information. Some of these improvements under the new rule include using science-based testing protocols to find more sources of lead in drinking water, establishing a trigger level to jumpstart mitigation earlier in more communities, ensuring the completion of more numerous and more thorough lead service line replacements, and for the first time, requiring testing in schools and child care facilities, and also requiring water systems to identify and make public the locations of lead service lines. Our professional opinion on this bill and the reason we support it is very simple. The fiscal impact of school districts in creating and implementing a testing program is small. The goal would be to identify that our Texas schools' water sources are safe. Conversely, if they were to determine that the lead levels were not below acceptable levels, the goal would then be to remediate those school water systems to eliminate the lead source. HB 605 addresses both of these priorities. We also agree with the fact that there is no need to test if the ultimate goal is not to remedy the causation at the source. In recent years, the state of Massachusetts reported over 3,500 schools with test results over the action level from 2016 to 2019. More than 700 of those excessive lead testing results were found in drinking water supplies at schools. During this same time period, Lynn Public School District, the fifth largest school district in the state of Massachusetts, had the highest number of tests above the 15 parts per billion action limit of all the state school, with 188 tests reporting at a high level. Yet the Massachusetts state database still lists no remediation action was reported for most of those tests. We cannot allow this mistake to happen to our schools, to our children here in Texas. This inaction in Massachusetts comes even after 2012 study by Jessica Reyes of Amherst College showed Massachusetts towns where children who had higher lead levels in their blood tended to have lower scores on the standardized MCAS tests. That's the equivalent to the STAR testing students take here in Texas. In the schools where students saw decreases in lead exposures in the 90s, they saw immediate increases in scores in the 2000s. We can do better than the state of Massachusetts. We are the state of Texas. In closing, this bill that protects children at the nearly 8,200 schools that still have not adopted a health and safety school water plan is an absolute necessity. Isn't that one of the main reasons why we're all here? To serve and protect not only adult citizens, but especially our children? I support this bill. The Texas Mold Assessors and Remediators Association supports this bill. And we sincerely hope that all of you here today will support this bill because it will help ensure the health and well-being of our children who are so vital to the future of our great state of Texas. Thank you very much for your time.
All right, thank you for your testimony. Any questions of this witness, member? I think Representative Bernal has a question, followed by Representative Mason.
I do. Thank you for being here. The representative has actually tried to do this more than once. I don't know why it hasn't happened yet. I appreciate the data you gave us about Massachusetts.
Yes, sir.
Can you in any way sort of ballpark or help us understand what you believe or know the scope of the problem in Texas to be?
I know that there are about 8,200 schools that don't have a safe water plan in place. And so without data of those schools, I would not know that I would say that there's risk.
And then I know that the risk is heightened the older the campus is.
That's correct.
Right? And,
yep.
And do you have any idea how old or new these campuses are, or like what's the, that's probably not the right question. Maybe a better question is, at what point did we switch? Because, you know, Representative Gervin-Hawkins and I share borders, and a lot of the schools that we represent are older schools. Up until what point is this a serious problem just based on age alone?
Age alone, you're looking at anything around 40 plus years. You know, in 2006, the last report I read was like the average age of schools in Texas was somewhere around 34 to 35 range.
Right.
So were we 15 years later now? So unfortunately, I don't have data of the new schools that kind of.
No, but you're saying that in 2006, the average age of the average campus was 5 years away from being in the red zone.
That's correct.
Now it's 15 years later.
That's correct.
Okay.
Yes. Yes, sir.
Thank you, Chair.
All right, Representative Mason.
When you talk about lead.
Oh, I'm sorry. Sorry.
Hi. I'll keep you one question longer,
Yes, ma'am.
at least. Thank you. In Dallas County, typically it's an issue that's a problem in the low income, which tend to be poor neighborhoods, which tend to be minority neighborhoods, that they have less political clout to keep out cement plants and factories and all kinds of commercial businesses that cause problems with the lead being in the dirt and the ground and so on. And so much so that there's the term environmental racism. Do you think that this is an issue that's throughout the state of Texas? Is it an issue that's specifically in poor neighborhoods? How far-reaching is this problem?
So I would say in response to that when we built these, well, I didn't build them, when we as a state built these schools many years ago, we were using pipes with lead in them. So at that time, I don't think there was any racial bias or, you know, low income bias in building these schools. That being said,
so this is more an issue of the pipes than it is of the.
When we're talking about water sources, absolutely. It doesn't mean that that's the only risk in these areas. What we want to do is eliminate that piece of the risk. There is still the risk that they can inhale this from, you know, your said sources there. That's still a risk, but we want to eliminate that in schools. I mean, these are the areas where these kids should be the safest, and we're pumping water into them that's, you know, potentially toxic and contains lead. We can get better at it.
Thank you. I was curious if this was more an issue of pipes or the environment around the schools.
Yep.
Thank you.
You're welcome.
Okay, thank you.
Thank you.
Thank you for your testimony.